In the mid-20th century, a seemingly miraculous drug was introduced to the world. Hailed as a wonder treatment for morning sickness, it promised relief to countless pregnant women. But beneath its promise lay a hidden danger, one that would forever change the way medicines are developed and tested. This is the story of thalidomide, the drug that taught us a critical lesson about chemistry, safety, and the complexity of molecules. Hi, I'm KO, and today we're uncovering the story of thalidomide, a tale of scientific discovery, tragedy, and the birth of modern drug regulations. From its introduction to its catastrophic effects, along with the lessons it taught us, this story is as sobering as it is transformative. In the 1950s, the pharmaceutical industry was booming. Scientific advancements were happening at a rapid pace, and companies were eager to develop new drugs to improve people's lives. Among them was Chemie Grünenthal, now Grünenthal, a pharmaceutical company based in West Germany, which had originally been founded by the Witt family in 1946 to manufacture antibiotics after World War II. At the time, one of the major goals of drug development was to create non-barbiturate sedatives, that is, medications that could help with anxiety and insomnia without the addictive and sometimes lethal effects of barbiturates. Chemists at Grünenthal synthesized thalidomide in 1953, and early tests suggested that it was a remarkably safe sedative. Unlike barbiturate, it did not seem to cause fatal overdoses, making it appear to be a perfect alternative. It wasn't long before someone suggested a new application, that is, treating morning sickness in pregnant women. Many pregnant women suffer from nausea and vomiting, often in the early stages of pregnancy, and at the time, there were very few safe options to alleviate these symptoms. Since thalidomide seemed so harmless, doctors began prescribing it widely to expectant mothers. By the late 1950s, thalidomide was available in over 40 countries, sold under different brand names and advertised as a miracle drug. It was marketed aggressively, and in some places, it was even available over the counter, meaning women could buy it without a prescription. For a while, everything seemed fine. Millions of doses were sold, and women praised the drug for providing relief from morning sickness and helping them sleep. But soon, a horrifying pattern began to emerge. Doctors started noticing a rise in babies being born with severe birth defects, particularly malformed limbs. Some infants were born with phocomelia, a condition where the limbs are dramatically shortened or absent, causing the arms and legs to resemble flippers. Others were born with missing ears, deformed eyes, heart defects, and damaged internal organs. The connection between thalidomide and birth defects wasn't immediately clear. At first, many doctors and scientists dismissed the report as isolated cases or the result of genetic mutations. But as more and more babies were born with these deformities, suspicions grew. One of the earliest people to raise the alarm was Dr. Widukind Lenz, a German pediatrician. He began investigating the increasing number of birth defects in his country and eventually traced them back to thalidomide. So, in November 1961, he publicly linked thalidomide to congenital disabilities, prompting swift action in some places. West Germany immediately withdrew the drug from the market, but by then, the damage had already been done. Across the world, an estimated 10,000 babies were born with thalidomide-related deformities, and thousands more pregnancies ended in miscarriages and stillbirths. The tragedy was immense, leaving families devastated and the medical community shaken. So, what went wrong? Why did thalidomide, initially believed to be safe, cause such catastrophic birth defects? The answer lies in chirality, a fundamental concept in chemistry. This concept was discovered by Louis Pasteur, first observing them in 1848 while studying tartaric acid crystals. Many molecules, including drugs, can exist in two mirror image forms called enantiomers. Imagine your hands. Your left hand and your right hand are mirror images of each other, but you can't swap one for the other because they do not perfectly overlap. That's exactly how chiral molecules behave, and thalidomide is no exception. Thalidomide had two such forms. In Latin, the rectus enantiomer, which translates right enantiomer, had the desired sedative effect. The other one, known as the sinister or left enantiomer, was teratogenic, hence highly toxic to developing embryos. At the time, scientists didn't fully understand how important chirality was in drug development. Even worse, the human body can sometimes convert one enantiomer into the other, meaning that even if a safe version of thalidomide had been given, the body might have still produced a harmful version. Once inside the body of a pregnant woman, the toxic enantiomer disrupted fetal development, particularly in the early stages of pregnancy when major organs and limbs are forming. This led to severe malformations, and because the drug was taken for morning sickness, which is an early pregnancy symptom, many women unknowingly exposed their babies during the most critical weeks of development. As the scope of the disaster became evident, lawsuits flooded in. Families sued pharmaceutical companies for damages, leading to long legal battles. Grunenthal and other companies were forced to pay compensation, but the process was slow and painful for victims. It wasn't until 2012, more than 50 years later, that Grunenthal formally apologized for the tragedy. Mr. Stark, chief executive of Grunenthal, issued his company's apology at an unveiling of a bronze statue symbolizing a child born without limbs because of thalidomide. The sculpture by the artist Bonifatius memorializes the victims of thalidomide. The German text below the chairs translates, and I quote, "In memory of the dead and the survivors of the thalidomide catastrophe." End of quote. The disaster of thalidomide also led to a complete overhaul of drug regulations worldwide. Before thalidomide, drug testing was far less rigorous than it is today. In many countries, new drugs could be sold without comprehensive safety testing. The thalidomide scandal changed everything. Governments introduced stricter regulations to ensure that new medications were thoroughly tested before being made available to the public. In the United States, the disaster was a major catalyst for the 1962 Kefauver-Harris Amendment, which required pharmaceutical companies to prove drug efficacy and safety before approval, conduct rigorous preclinical testing, including animal studies, and follow stricter oversight in clinical trials. The tragedy also highlighted the importance of regulatory agencies, strengthening the role of organizations like the Food and Drug Administration, also known as FDA, in ensuring public safety. Despite its dark history, thalidomide was not entirely forgotten. Years after the disaster, scientists discovered that the drug had powerful anti-inflammatory and immune-modulating properties. Today, thalidomide is used in strictly controlled settings to treat diseases like leprosy and multiple myeloma, a type of blood cancer. However, its use is tightly regulated, with extreme precautions in place to prevent it from being taken by pregnant women. The story of thalidomide is a stark reminder of the power and danger of medicine. It taught us about chirality, the importance of rigorous drug testing, and the devastating consequences of scientific oversight. More importantly, it forced the medical community to prioritize patient safety and demand higher standards for drug approval. Today's strict pharmaceutical regulations exist because of tragedies like this one. So, as we reflect on this chapter of medical history, let it remind us of the balance between scientific discovery and ethical responsibility. Sometimes the greatest lessons come from our darkest mistakes. Thanks for watching, and I'll see you in the next video.
Double Helix, coded to reality.